Morning. What a crowd. My God. Who knew so many people would be interested in healthcare financing in Boston? Thank you all for coming. We actually had to turn people away, but there were people that, whatever. But there are 450 people here at this session, and we hope you'll all find it worthwhile. I want to wish you all a happy new federal fiscal year. Begins today. My name is Phil Johnston, and I'm the chairman of the board of the Blue Cross and Blue Shield Foundation. And I want to introduce Andrew Dreyfus, who is our great CEO and president of Blue Cross Blue Shield. Used to work in state government. He and I worked in state government together, and he used to run our foundation, as many of you know. And Andrew, thank you so much for your leadership on not only this issue, but the whole range of health reform issues that you've been involved with all these years. And I also want to acknowledge, and you'll hear from her at the conclusion of the session, our equally wonderful president of our foundation, Sarah Islen. And I want to thank Andrew and the corporate board of Blue Cross for having established the foundation. I think it's been about 11 years now, and I've been honored to chair it all of these 11 years. And we've been deeply involved in this health reform process, beginning with the Speaker and the Governor and the Senate President and Senator Kennedy 7 or 8 years ago. The foundation developed the roadmap to coverage, and so we followed and tracked this entire process all along, and now we're in the second phase, which is extremely important in terms of making sure that healthcare is affordable as well as accessible for every man, woman, and child in our state. I'd like to acknowledge the elected officials and leaders from the administration and from the legislature. Glenn Shore, who is the director of our connector. Representative Jeff Sanchez, the chairman of our Committee on Public Health. Representative Tom Conroy. Our terrific state auditor, Suzanne Bump, who will play a key role in monitoring this whole process, the new legislation as we move it forward. Commissioner Aaron Boros, who is the successor to Sarah Islen, with whatever agency, whatever it's called now, with the new, Dick Phipp or Hick Phipp or whatever. Representing the state Senate, Senator Dick Moore, who's, of course, a veteran member of the legislature. Really veteran, because he and I served in the House together, which was a long time ago, like decades ago. And our great Secretary of Health and Human Services, Judy Ann Bigby. You'll be hearing from virtually all of them this morning. We're particularly fortunate this morning to have Speaker Bob DeLeo join us. Speaker DeLeo is someone who understands the streets of Boston and the halls of the State House. He's a renowned budget expert, consensus builder, and a determined, effective leader. He's represented the 19th Suffolk District since 1991. He served as the chairman of the House Committee on Ways and Means, the House Committee on Bills and Third Reading. He served as the House Chair for the Joint Committee on Local Affairs and chaired the House Committee on Ethics. And on January 28, 2009, he became the Speaker of the House of Representatives. Since his very first days as Speaker, Bob DeLeo has been committed to reform. Within 100 days of assuming the speakership, the House passed sweeping reforms on House rules, on ethics, on transportation, and on pensions. Indeed, one of his very first acts as Speaker was to limit his own term as Speaker to 8 years. More recently, he spearheaded far-reaching judiciary reorganization legislation in concert with the Chief Justice of the Supreme Judicial Court. Earlier this year, he reintroduced gaming and jobs legislation with the support of the Senate President and Governor Patrick. But it is his leadership on health care, which is the issue which is closest to all of us in this room, that brings him here today. Speaker DeLeo understands that tackling health care costs, among the most difficult issues that face our state and our nation, is critical not only for preserving the gains in health care coverage and access we have witnessed since '06, but also for the broader economy here in the Commonwealth. Last year, Speaker DeLeo successfully brought nationally heralded legislation cutting health care costs for cities and towns in Massachusetts. And under his leadership, the House passed the sweeping health care cost containment law, now known as Chapter 224 of the Acts of 2012, an unprecedented legislative achievement that aims to bring health care spending growth in line with growth in the economy. That was no easy feat, as we're all well aware. Without the commitment and the bravery of the Speaker and the exhaustive work of the House and Governor Patrick, Secretary Bigby, and others in the administration, this law would never have come to pass. He's a great leader in general in our Commonwealth, but in health care, he's the man. Please welcome our terrific Speaker of the House of Representatives, Bob DeLeo.
Thank you very much, Phil, and thank you, Sarah, and good morning, everyone. And it's a pleasure to be here as we celebrate the inception of the historic health care legislation. So many people, including many of us here today, have had a hand in bringing this to fruition. I also want to recognize the Vice Chairman of the Committee of Healthcare Finance, Tom Conroy, who also was here today. At least I think I saw. There's Tom. Thank you. Welcome, Tom. But I also want to welcome another good friend as well, Jim Valley, by the way, former representative. See, Jim, when you're gone, you're gone. See how Johnston forgot you now, okay? But a little more than 3 years ago, I stood before this group to talk about the House's commitment to our universal health care law and expressed our commitment to reform the payment system. The foundation, by the way, has been such an important voice in the conversation on health care reform here in Massachusetts. Earlier this year, I am proud to say that we fulfilled that commitment. We passed a law that focuses on containing health care costs while maintaining the quality of patient care. There are many people who deserve thanks for their role in helping us fulfill our promise. First and foremost, there is Governor Patrick, and obviously Secretary Bigby along with him. The governor signed this bill into law just under 2 months ago. Whether it was our weekly leadership meetings or during his statewide address, Governor Patrick made sure that we all knew about his strong commitment to cutting health care costs. The governor, the Senate President, and I all understood the importance of cutting health costs for families and businesses during these very difficult fiscal times. We knew we had to work together to make a change. As I mentioned earlier, we started talking about cutting health care costs some 3 years ago and began working on it in earnest almost 2 years ago. I was very fortunate to have the assistance of a very smart, hardworking legislator to help our efforts in the House, a gentleman by the name of Steve Walsh, I think, who did such an excellent job visiting 54 hospitals and holding some 800 meetings throughout this process. And I was so proud because I felt that he did such an unbelievable job. In the House, we were also fortunate to have a gentleman, the majority leader by the name of Ron Mariano, who I think sort of stirred the discussion very early with his legislation, which he filed. I refer to Ron as the Michael Phelps of healthcare reform. And of course, all the members of the Healthcare Conference Committee. And I'd be remiss if I didn't also mention a gentleman on the Senate side who's been working, has been one of the leaders on this issues for so many years, probably I think longer than any other member of the conference committee or anyone involved in this, and that's a gentleman I think who has such a vast knowledge of this subject, Senator Richard Moore. Thank you, Dick, for what you did as well. I didn't mean to imply you were old. I just said you were involved in the issue for a long time. And there was also a gentleman who I saw earlier, who, in representing the Senate President, and now has joined the administration, but again, his knowledge on a day-to-day basis was so welcome. David Seltz, I think I saw David here earlier this morning as well. Congratulations to you, David. But we all shared in one mission: to limit cost growth while maintaining high-quality health care and innovation. Our focus was on increasing efficiency and cutting costs within the system while giving patients the tools to make decisions. Through our improved method of governance, information technology, and other changes, I am confident we will achieve our goal. And I will tell you that since when I first became Speaker of the House, one of my first major duties that I felt was to travel around the state and to talk to especially businesses, and talk to businesses in the sense of how we can be more business-friendly here in the Commonwealth. And what I heard over and over and over again, that if we expected businesses to either come to Massachusetts or to grow in Massachusetts, we had to have a serious discussion about health care costs. So that's one of the other reasons I am so proud of this legislation. And I have such high expectations. Legislation such as this healthcare cost containment law will set Massachusetts, I believe, on a path towards total economic recovery as we on Beacon Hill continue to work for a strong financial future. The panels that will participate here today will help us understand the next steps and the implementation of the law. You will hear from government leaders, private providers, and insurers, consumer advocacy groups. This forum will provide a chance to hear in much more specific detail about the opportunities our law has provided. Once again, I want to thank you for having me here today and hope you have a great morning. Thank you and have a great day.